This is Gord Moker of Safe Saskatchewan with the business case for injury prevention, September 24th, 2013. Safe Saskatchewan is a nonprofit organization. We're a public-private partnership dedicated to putting an end to our unintentional injury epidemic. As you see, those are our Safe Saskatchewan strategic partners, all of who have appointed a senior manager to our Safe Saskatchewan Board of Directors. Our vision is an injury-free Saskatchewan where safe lifestyles influence how we live, work, and play. And our mandate is primarily around coordinating injury prevention activities in the province through the development of collaborative, broad provincial injury prevention strategies. In addition, we support all the organizations currently involved in injury prevention in the province. For instance, our partners at WorkSafe Saskatchewan, the partnership between the Workers' Compensation Board and the Ministry of Labour Relations and Workplace Safety, manages the workplace safety stream. SGI manages the road safety stream, and we support them in all their efforts to move forward. Mission Zero is our philosophy. We believe that the only acceptable number of injuries in Saskatchewan is zero. We also believe that all injuries are predictable and preventable. On an average day in Saskatchewan, 435 people are injured. Of those injured, 26 will end up in the hospital, 10 will suffer a permanent disability, and 1 person will die. We have among the highest injury rates in all of Canada. In the workplace, for instance, we have the second highest workplace injury rate behind Manitoba. But when we measure our overall injury rate, which includes injuries that occur at work, at home, at play, on our farms and ranches, and on our road system, we have the overall highest injury rate as measured by person years of life lost. To give you a glimpse of a year in the life of Saskatchewan, we know of about 158,000 injuries that occur on our road systems, at home, at work, and at play. About 40,000 of those injuries occur in Saskatchewan workplaces. The remainder, 120,000 injuries, occur to Saskatchewan working class people, children, or seniors. That's an injury every 3.5 minutes. And we consider that about 100,000 injuries happen to working class citizens after they're done work in Saskatchewan. We have about 500,000 people who are working in the province, full-time, part-time, and casual. So consider 500,000 with 100,000 injuries that occur. That's an injury rate of about 20%. It's estimated that about 40% of all emergency room visits come about as a result of preventable injuries. So the next time you visit an emergency room in Saskatchewan here, of the 10 people there, 4 or 5 are there because they've had a preventable injury. 9,800 hospitalizations every year, and our overall hospitalization rate from injuries is twice the national average. And by the end of the year, 3,500 people's lives will change forever as they'll become permanently disabled from preventable injury. And almost a death a day, 330 deaths from preventable injuries in our province every year. In Saskatchewan, there's twice the chance that you or I will have an injury after we're done work today, 4 times the chance that we'll suffer a permanent disability, and 5 times the chance that we'll die from a preventable injury after 5 o'clock. Does safety stop at 5 o'clock in Saskatchewan? Most certainly, based on the statistics, it does. Back in 2001, SmartRisk, in partnership with the Acquired Brain Injury Partnership Project, the Saskatchewan Ministry of Health, SGI, and the Saskatchewan Prevention Institute, issued the Economic Burden of Unintentional Injury Report in Saskatchewan. That report cited just under $600 million as the annual cost to our economy of preventable unintentional injuries. Now, when we index that to today's dollar value, and when we add workers' compensation, auto, and other private disability insurer costs, which weren't included in the economic burden study, we estimate a conservative estimate of $1 billion on the Saskatchewan economy every year. That's the equivalent of $1,000 for every man, woman, and child in an annual economic burden in Saskatchewan. To take a look at the impacts on our healthcare system, the Saskatoon Health Region for instance, one of 12 health regions in the province here, has a population of over 300,000. So while this is not an exact science, this will give you a picture of the economic burden to the healthcare system in Saskatchewan. So we estimate very close to $300 million every year from unintentional injuries is a burden to the the Saskatoon health region. Their annual operating budget to the 10-11 budget year was $912 million. Now, taking a look at the impact of preventable injuries on Saskatchewan communities, and looking at Humboldt, for instance, a city, 6,500 in population, carries an annual economic burden on average, 6.5 million, versus their operating budget to the end of 2012 fiscal year of $9.8 million. Now, in my previous experience with the workers' compensation boards, I found that many employers were focusing on the premiums they paid to the workers' compensation board. And as you may know, regardless of the cost of a claim, the annual premiums an employer pays covers the cost of an injury regardless of the level of costs for that particular injury. But let's just take the average cost of a time loss claim in 2009, taken from the Workers' Compensation Board's annual report. Direct costs are including such things as wage loss. It could be medical costs, retraining costs, average $12,200, excuse me. And when we take a look at the indirect costs, which include such things as overtime, downtime, damage to property and equipment, and other indirect costs that impact an employer's bottom line over time, and consider that indirect cost could be anywhere from $4 to $12 for every dollar of WCB costs. Taking a conservative estimate, we can expect to see just under $50,000 of indirect costs. Now, it's those indirect costs that impact an employer's bottom line over time and have a detrimental effect on the profitability and stakeholders' equity for any business. So the total costs on an average time loss claim in 2009, for instance, are upwards of $61,000. But let's just take a look at the impact of those $48,932 worth of costs on an employer's bottom line, or to put it another way, it would take $815,000 in additional sales to cover $49,000 in indirect costs at a profit margin of 6%. Well, what about a worst case scenario when there's a workplace injury and the costs are high and the time away from the workplace is high as well? Here's an actual example of a critical workplace injury from one of our strategic partners at K-Line Maintenance and Construction. In this particular instance, there was a lineman, a young fellow who fell off the pole and broke his arm. Their calculated direct costs were $262,000. This is just one claim. Their indirect costs, which included loss of business, impact to reputation, and other costs, $2.27 million, $2.3 million in indirect costs for the total costs on the claim of $2.5 million with 180 days lost. To recover that particular $2.3 million in indirect costs, it would take an additional $37.8 million in sales at a profit margin of 6%. Now, these costs are pale in comparison to the human costs of pain and suffering and the impact on family, the impact on individuals, and the impact on community. The U.S. National Safety Council says, for instance, that off-the-job injuries are up to 8 times more costly than workplace injuries. We think this is the case because we don't have off-the-job what we do have in the workplace, and that's employers employees, healthcare providers, workers' compensation, safety associations, and others, all working together to prevent injuries in the first place, but also to mitigate the loss when an injury does occur, and to get that person back to meaningful employment when there's an opportunity to do so, with such programs as return to work programs and alternate duties. So we're starting to get a picture of workplace injuries versus non-workplace injuries, and to get a clearer picture of the potential costs of a situation where a worker is at home on the weekend, perhaps working on a project, the potential costs to that business. We've had one of our strategic partners, Mosaic Potash, looked at their potash business unit, which includes 4 mines here in Saskatchewan, 1 in New Mexico, and 1 in Michigan, a total of 2,500 workers, and looked at the number of days they've lost to workplace injuries over a 12-month period and compared that to the number of days their employees lost to injuries that occurred away from the workplace. Now, this is interesting, and it's interesting because while this is a Mosaic Potash case study, which is an organization working in the mining industry here, our sense is that what you're about to see would apply whether you're in mining, forestry, the healthcare industry, or the building construction industry in Saskatchewan. What they've experienced is in that 12-month period, they lost 100 days to workplace injuries and 6,100 days to injuries that occurred to their employees off the job after work. This is 30 person years of time lost for injuries that occurred away from their workplace. Their calculation of direct costs, $1.5 million. Their calculation of indirect costs, a very conservative estimate of their indirect costs, $6 million, for a total of $7.5 million in costs. When you take $7.5 million and you divide it by just about 6,100 days, and these are days dedicated to disability, the financial impact is very close to $1,200 per day. So here's an opportunity for industry to take a look at rounding their injury prevention strategies beyond the workplace and into the community, and to support their employees with a healthy and safe lifestyle 24/7. In this particular case, $6 million in costs would have required an additional $100 million in sales at a profit margin of 6%. But here's the good news. The U.S. Centers for Disease Control and Injury and Prevention list, for instance, if you spend $1 on a smoke alarm, you'll save $69 in costs. That's a 6,900% return on investment. $1 spent on a bike helmet saves $29 in costs. That's a 2,900% return on investment. There's a 3,200% return on investment. There's a 300% return on investment. And what we found when we built business cases, whether it's around seniors, falls, or other type of injury prevention, the least we've seen in return on investment is 300%. We've seen returns upwards of 1,200 and 1,500%. A demonstration that wherever you invest in injury prevention, whether that's at home, at work, at play, on our farms and ranches, and our road system, rest assured that you'll get an exponential return on investment. It's all about a sustainable advantage, and here's a quote from Bette Wilson's book: "The most important asset you will ever have, and the one that appreciates the most, is the human capital you hire, develop, and retain." And we're looking at growth here in Saskatchewan, and there's some factors that we'll be unable to control. But I think about the importance of retaining experienced, qualified people in our current workforce. And I think about the potential that holistic injury prevention strategies can bring. There's nothing like investing in the people, which are your greatest asset in any organization, and keep them as best you can healthy and safe. It's all about working towards a cultural transformation in our province. It seems that we seem to accept injuries as a part of life every day in the province. We say, well, another injury happened on the ring road here in Saskatchewan, a collision, and that's accepted. We don't have to accept that. If we can believe that the only acceptable number of injuries is 0, we'll be well on our way on our mission to put an end to our injury epidemic. Our strategic priorities primarily are all around cultural transformation, facilitating and coordinate strategies and activities aimed at transforming the Saskatchewan culture and positioning injury prevention as a core value. Safe Saskatchewan and our partners are on the road to putting an end to our injury epidemic. We have been working with the Saskatchewan Ministry of Education in the development of a community safety education strategy for our K-12 children and youth. The Saskatchewan Health and Safety Leadership Charter has currently 341 business, government, union, and community leaders who have signed the charter and subscribed to the 7 principles of the charter to advance health and safety both in and away from their workplace. We are considering increasing education and awareness in the province, perhaps through the development of a social marketing strategy. We are asking our charter signatories, while they have signed the charter and endorsed Mission Zero in principle, we're asking them to endorse it more formally by signing a Mission Zero partnership agreement. And with that, we turn over the use of the Mission Zero logo to them to support their injury prevention efforts. And we're looking for opportunities to present the business case for injury prevention, to all of our partners in industry, in communities, in unions, and communities throughout the province. It's all about working together to improve the lives of the people of Saskatchewan, enhancing the economic environment for business, and saving millions of dollars in health and social costs. It's all about this life-saving work. It's all about accepting that the only acceptable number of injuries is 0 and believing in Mission Zero so that we can all live injury-free.